Hello everybody, hello sir, good afternoon. I want to introduce myself. My name is RIZKI. I'm from class Occupational Safety and Health in the afternoon. And then I want to describe to you about occupational safety and health in a new normal situation. So I will just start. The COVID-19 pandemic that has hit all countries shows an important function of organizing occupational safety and health for each field of work. In addition to ensuring the workplace is safe to use, occupational safety and health is very important to ensure health and limit the spread of viruses that are easily transmitted. That way, the application of occupational safety in the work area is key in protecting the health of workers and their families. Community service activity aimed to conduct socialization related to occupational safety and health. To construction worker, example CVDRB, Domain Rancang Bangun in the Stikas Elizabeth. This is important in an effort to prevent the spread of the coronavirus at work sites. Virus efforts needs to be made to prevent the spread of the COVID-19 virus in the work environment in the application of the new normal, including the creation and dissemination of health protocol (SOP) in areas, building, location in the stickers environment. The method used in this activity is by planning, implementing, observing, and evaluating the implementation of occupational safety and health, socialization, and new normal situation for construction workers. The result of this service activity is the creation, installation, and socialization of educational media in the form of posters and banners as a means of media for health education for in new normal COVID-19 in Stikas Elizabeth. The increasing form of caring for others in the new normal COVID-19 left patterns in the Stikas Elizabeth by providing quarantine protection facilities for workers from the coronavirus by providing masks and hand washing facilities. And then, currently the coronavirus pandemic is still happening around the world. The spread of the coronavirus through respiratory droplets from one person to another person, which often produce when talking, coughing, or sneezing. This disease can be spread through small droplets from the nose or mouth when coughing or sneezing. The droplet then falls on the surrounding object then if someone touches an object that has been contaminated with the droplets and that person touches the eyes, nose or mouth, triangle face, then the person can be infected with COVID-19, or it could be someone infected with COVID-19 when accidentally inhaling droplets from the sufferer. The main clinical symptoms that often appear are fever above 38 Celsius, cough, and difficult breathing. COVID-19 symptoms are defined as patients with acute uncomplicated upper respiratory tract infection, which may be accompanied by fever, fatigue, cough, anorexia, malaise, sore throat, congestion, or headache. One of the countries experiencing this pandemic is Indonesia. COVID-19 has infected the Indonesian population, both elderly people who have disease complications, babies and will be small, as well as people with weak immunity are most susceptible to this virus attack. Even someone who lives or visits a certain city or place that has been infected or a secret zone is susceptible to this virus if it doesn't comply with the protocol set by the government. During the pandemic, the Indonesian government has provided 3 ways to prevent coronavirus infection. The 3 ways are to know how to reduce risks, know the correct information, and know what to do when sick. And then, in an effort to reduce risks, the government has advised people to maintain clean lands including washing their hands with soap frequently and covering their mouths when sneezing or coughing. The use of masks is recommended for use, especially for those who are sick, because the COVID-19 virus is not transmitted through the air but through droplets, sneezes, or coughs. In addition, people are also encouraged to carry out social distancing by avoiding attending large meetings or crowds of people, and if someone has to be around people, it is obligatory to keep a distance from the crowd. According to WHO, it's good to maintain a distance of at least 1.3 meters when in public, especially if someone is coughing or sneezing. And then these efforts, it is believed to be able to prevent yourself from contracting a virus that attacks the respiratory tract. In social distancing, residents are also asked to study, work, and worship at home and reduce activities outside the home. Prevention of the spread of COVID-19 is implemented in the manpower sector, one of which is for construction workers in accordance with a circular from the Ministry of Manpower concerning protection of workers or labor and business continuity in the context of preventing and overcoming COVID-19. I took a reference from a socialization activity in July 2020. This socialization was in the form of implementing the Occupational Safety and Health program in a new normal situation for construction workers in the Stikas Elizabeth, Semarang. The activities carried out in the implementation of the program are socialization of hand washing, and washing soap, and use of masks and social distancing, and the availability of educational media that support the health of the new normal COVID-19. This activity is carried out by implementing the new normal COVID-19 health protocol. The number of construction workers who take part in this activity is 20 people by following existing social distancing rules. Following are the results of the Occupational Safety and Health Socialization Community Service Activity Questionnaire in the new normal situation for construction workers in the Stikas Elizabeth, Semarang. In the table, it can be seen that there are 20 construction workers who answer satisfied with the implementation of good socialization activities, where 13 people satisfied with good socialization time management, where 14 people answer satisfied with the presentation of good socialization, where 12 people answer satisfied with the educational media good socialization activities, where 16 people answered that they were satisfied with the infrastructure for socialization, both of which were good, answered that they were satisfied with the implementation of the new normal COVID-19 health protocol was 12 people. And then it can be seen that the results of the evaluation of the knowledge and understanding of the socialization material on how to use masks correctly answer 19 people understood knowledge and understanding of the socialization material how to wash hand correctly who answer understanding as many as 18 people, and the knowledge and understanding of the socialization material how to keep the correctly distance and swearing understand as many as 19 people. And then, during the implementation of these community surveys, there were no obstacles to be encountered. The community surveys activities carried out have been going on very well and on time. This can be seen from the interest of construction workers in participating in activities reaching 2000%. This indicates the construction worker have a positive response to the activities that have been carried out. The community surveys implementation team become even more enthusiastic because the construction workers could understand the socialization matter and practice or apply the socialization activities very well. During the activity, the construction worker enthusiastically paid attention to the socialization of the SOP for washing hands, the use of masks, and social distancing carried out by the team. In addition, when the implementation team gave health protective equipment in the form of masks to the construction workers. The construction workers welcomed them very happily and hoped that the implementation team could hold community service activities in the future. And then, work safety in this is the main means of preventing accidents, disabilities, and deaths as a result of work accidents. Good work safety is a gateway for workforce securities. Work safety also includes the provision of personal protective equipment (PPE), machine maintenance, and human working hour arrangements. Another opinion of Hasibuan, he said that safety includes controlling loss from accidents and the ability to identify and eliminate unsuspectable risks. The Occupational Safety and Health Program is a program carried out by an organization as an effort to provide protection for workers and other people who are in workplace or company in a safe and health condition, and so that every source of production is used effectively and efficiently. Occupational safety and health is one of the key factors. It's business continuity and worker protection. The COVID-19 pandemic is a momentum for entrepreneurs and all business actors in the importance of implementing occupational safety and health, especially in the field of occupational health actively and efficiently in a workplace. And that's all I can describe to you. Thank you for your time. Thank you, sir.